Hello, welcome to today's Here's to Your Health podcast. I'm Don Lintzman, your host. My guest on the podcast today is Sarah Steadham. Sarah is a radiologic technologist here at CCMH, and Sarah, thank you for joining me today.
Thanks for having me.
The reason for our conversation is October is Breast Cancer Awareness Month, and we want to spend a little bit of time talking about that and helping people to understand a little better about both breast cancer and about the testing, the mammographies that go along with that, and a few other things as well. But before we start on that side of the discussion, let's talk a little bit first about the genetic part of this, because in just about any cancer, when we start talking about it, people say, well, none of that runs in my family. But I think that maybe isn't quite as big of a thing as we imagine it is.
Yeah, so as far as breast cancer cases go, about 5 to 10% of them are thought to be hereditary if they have a first-degree relative, which is mother, sister, daughter, that are diagnosed with breast cancer. And if they have that, then that approximately doubles the patient's risk for breast cancer. But once again, that's only 5%, 5 to 10%. So even if it's not in the family, it doesn't mean that you can't get breast cancer.
Yeah, I think the point of that conversation is that people don't get complacent, that they don't say, well, I don't have any of that in my family, so then I don't have to worry about that. And I think the answer to that question is yes, I think you probably ought to be, because the hereditary factor doesn't play as large of a role as we had originally anticipated. The other thing that people talk about a lot is, and we do the same thing, we talk about prevention, because there are some cancers that you can do some things that help prevent the occurrence.
Yes.
But in this case, I don't think there's anything really you can do as far as breast cancer is concerned.
Other than getting early screenings, doing self-breast exams, and maintaining healthy weight and lifestyle, there really isn't anything that they know that can prevent it as of right now.
One thing that we have talked about briefly is the effect smoking has on perhaps the incidence of breast cancer. What say you about that?
Yeah, women who have smoked 10 years or longer do seem to have a higher rate. It's about 10% higher risk for breast cancer than women who have never smoked. So if you are a smoker or if you have smoked, you do have a higher risk of breast cancer.
A couple of other things that do happen in the course of healthcare. One is oral contraceptives. The other is hormone replacement therapy, maybe at either end of the spectrum when you think about where women are in their life cycle. What about that in terms of breast cancer? Do oral contraceptives or does hormone replacement really have any sort of an effect on the incidence?
Yeah, there is actually a slight risk, a slight increase of breast, ovarian, and uterine cancer for hormones, particularly estrogen. There is a estrogen fed cancer for breast cancer, but it also could lead to a slight increase in those other cancers as well.
My guest on the podcast today is Sarah Steadham. Sarah is a radiologic technologist here at CCMH. We're talking about breast cancer, and because October is Breast Cancer Awareness Month. Sarah, when we talk about mammographies, because you've done a ton of those, in fact, let's just stop for a second. Tell us a little bit about your background, because you've been doing this radiologic technology thing for a while.
Yeah, I started doing x-rays. I graduated in 97. I started learning mammos in 2003, and I have taken several of my boards. I took my mammo boards in 2010. I also have CT and my bone density. So I've been doing mammos for about 21 years now. I've seen it go from film and, the hard plates that you had to have 40 pounds of compression on, up to digital, and now to the 3D, and it's just the last 20 years has improved, not only in the comfort for patients, but the fast exam time and the quality and the images that we get now are so much better than they used to be.
I have to think that the digital technology has come such a long way that diagnosis is a lot easier than it used to be.
Yes, both in we have lower false positives, and we also have more possible positives that would not have been seen on film. So it's good for both reasons. It's amazing, the technology.
How long does a mammography actually take? How long does a test take?
Usually from start to finish, it's about 20 to 30 minutes. We'll go update the patient's history form, and then we'll do the 4 images, 2 images on each breast, and then they'll get dressed and they'll be free to leave, and then we'll send them out a letter with their results. Their doctor gets the report either later that day or the next day. If we need them to come back, we usually call within a day or so to get that scheduled.
And I have to think that with the improvement in technology, that the comfort level for mammographies, I mean physical comfort level for mammographies, is also improved.
Yes. And I have also been getting my mammo for 16 years, so I can say personally I feel it's improved, but we use the soft mammo pads that help kind of absorb a little squish, and we're very good at communicating with the patients. If they're uncomfortable, we can reposition a little. It's not a comfortable test, but it should not be painful. And I feel like they used to be painful, and they're really just not nearly as bad as they used to be.
And a mammography is one of those tests that does not require a referral from a physician.
Correct. As long as we have a physician or a PA or a provider that the patient can follow up with and have the report sent to, they can just call the department and get one scheduled. Usually starting around age 40 is when we usually start screenings.
My guest on the podcast today is Sarah Steadham. Sarah is a radiologic technologist here at CCMH. We're talking about breast cancer awareness because October is Breast Cancer Awareness Month. I think I want to back up for just a second, Sarah, and talk a little bit about what women can do on their own when it comes to self-exams in order to be able to have that sort of early detection that we keep talking about.
Yeah, so we recommend they do monthly visual and physical exams of the breasts. Usually, they can stand and look in the mirror and make sure they're visually no dimpling, no sagging, no obvious, red marks or anything. And then in the shower usually is the easiest place to check for lumps or any areas that might feel different.
And I think one thing to keep in mind here is that the earlier we can detect any cancer, but especially breast cancer, the greater the number of options when it comes to treatment.
Yes, that's true. Yep. The earlier we can detect it, there's many options that they can do, whether it be ultrasound, MRI, and then come up with a plan. And the earlier detected, it's one of the most treatable cancers if we can catch it early.
Yeah. So if people are concerned about discomfort, women are concerned about discomfort from mammograms, you would say?
I would say don't let that discourage you from coming in. All of the mammotechs we have here are wonderful. We will walk you through everything, and we just have good communication, and we don't want you to be in pain. We want you to get a good exam, but we will try our best to get good pictures and keep you as comfortable as possible.
And a couple of things on my side. First of all, don't worry about the construction. Just come up here, get parked, walk in the door. We'll help you find where you need to go. That's not an issue. And to call and make an appointment for a mammography, you'd call our main number, 712-265-2500. That number goes directly to the switchboard, and they will send you right over to radiology, and you can talk to them directly, and they will help you get your appointment made. Anything else you want to share before we leave today? I mean, we certainly want to make sure that people understand that just not October for mammographies.
Yeah. Year long. You can come anytime, any month. A lot of times there is a myth, though, that I did want to bring up, that men don't get breast cancer. And that is not true. Approximately 2,000 men get diagnosed every year with breast cancer. So it is not only important for women, but for men also to, if there's any changes, don't be ashamed. Come in, get it checked out. Make sure that nothing's going on.
Like I always say, men are people too.
Yes.
Sarah, thank you so much for your time today. I appreciate it very much.
All right, thank you.
My guest on the podcast today is Sarah Steadham. Sarah is a radiologic technologist here at CCMH, and we've been talking about Breast Cancer Awareness Month because October is Breast Cancer Awareness Month. We encourage all women to contact their appropriate provider. If you're in Denison, Crawford County, obviously we want you to contact us, and we will help you get your mammogram scheduled and to get that test completed so that you can have some peace of mind moving forward. I'm Don Lintzman, your host on the Here's to Your Health podcast. Thank you for listening. Have a great day.